I'm going to be talking about new treatments in the 20th century today. So alternative treatments first. Alternative therapies became increasingly popular in the last few decades of the 20th century in Britain. These treatments are not scientifically proven and are often not effective at all. There was little evidence for these treatments, so William Farr's collection of medical statistics helped Dr. Snow discover the cause of cholera outbreaks, and Hippocrates, Galen, and Hunter all supported scientific observation of patients to find the best treatment. Most alternative therapies are not backed up by statistics, observation, or scientific research. Culturally, alternative medicine is different in the modern day because it is not mainstream or accepted practice. This is the opposite of medicine in the medieval era, which was dominated by medicine from apothecaries, etc. Alternative treatments today generally use natural herbs or plants, or theories about the body to relieve pain and illness. Some of these treatments are more accepted and are available in the NHS. For example, acupuncture, which is where people put needles in certain points of someone's body, and homeopathy, which is treating people with weak solutions made of natural substances. There has been a trend recently towards positive health. This means that people focus on the prevention of disease and illness rather than curing it. This means a focus on prevention rather than cures. People are now more concerned with a healthy diet and regular exercise. And this has been accompanied by a rise in screening, which checks people to make sure they are healthy and catches early signs of disease. So, as we just mentioned, alternative treatments are not statistically proven and are often not effective at all. So just to recap on this positive health recent movement, it shows that people are now more concerned with a healthy diet and regular exercise, which helps people prevent diseases as opposed to just focus on treating them. Transplant surgery in the 20th century. So technological developments have allowed us to do transplants of organs and other body parts from one person to another. In 1952, surgeons successfully performed an organ which was a transplant, and the organ was a kidney. The first organ transplant in Britain was in 1960. In 1967, a South African surgeon called Christian Barnard successfully performed a heart transplant for the first time, but the patient only lived for 2.5 weeks. The first heart transplant in Britain was in 1968, so a year later. In 1986, a British woman called Davina Thompson becomes the first patient to successfully receive a heart, lung, and liver transplant. Transplanted organs were often rejected by the body because the body's immune system recognized this body part as not from that person or foreign. So this means the immune system would attack it as if it was a bacteria or a virus and cause damage to the organ. Immunosuppressant drugs can stop the body from rejecting transplanted organs. In 1970, a British scientist called Roy Kane developed a drug, immunosuppressant, which stopped the body rejecting transplanted organs. This was called cyclosporine. In 2006, the first partial face transplant was successfully performed. In 2008, the first full face transplant was successfully performed. These might be used, for example, to treat someone who's a victim of burns. So I've just given you a lot of dates about when different transplants happened. So we know in 1967, it was the first heart transplant done by a South African surgeon called Christian Barnard. We know in 1968, it was the first heart transplant in Britain. And just to recap and look back, we know that in 1986, Davina Thompson became the first patient to successfully receive a heart, lung, and liver transplant. And of course, the drugs are called immunosuppressants, which are what stop the body from rejecting transplanted organs, as they are literally suppressing the immune system to stop it attacking them and thinking the transplants are foreign. So cancer treatment has also changed in the 20th century. Cancer is a disease where cells mutate and grow very quickly. These cells spread around the body and can kill people. Henri Becquerel and Marie Curie discovered radiation in 1898. Since then, radiotherapy has been used to kill cancer cells. Radiotherapy targets cancer cells using gamma rays and X-rays. In World War II, doctors found that some drugs could treat cancer. This is called chemotherapy. Some drugs, like folic acid, can stop cancer cells from growing. The latest treatments of cancer are called immuno-oncology. They involve using the body's immune system to attack cancer cells. White blood cells, called T cells, can target and kill the cancer cells. So, just to recap, we know that Henry Becquerel and Marie Curie discovered radiation in 1898, and since then, radiotherapy has been used to kill cancer cells. So, just to recap on what cancer is, it's when cells mutate and start to grow rapidly, forming tumours, and they can be fatal, which means it can cause death. So let's just think about what we've learned so far. We know that in recent years, there's been a trend towards positive health, and this means that people focus on the prevention of disease and illness rather than just curing it. And as we've learned already, we know that the main issue with transplants was that the transplanted organs were often being rejected as the immune system was seeing them as foreign. So what do we know so far about cancer treatment, which I just mentioned? We know that chemotherapy uses drugs to treat cancer, that immuno-oncology is a new type of cancer treatment, and that radiation was discovered by Becquerel and Curie. And as I talked about earlier with alternative medicine, we know that now, which is the opposite to medieval times, it's unproven and it's not mainstream or very common. So just to recap again on that immuno-oncology, which I mentioned earlier, it's for one of the latest treatments of cancer, which involves using the body's immune system to attack cancer cells. That's all with regards to the new treatments in the 20th century. Thanks very much for listening.